What causes UTIs? Is UPEC behind bladder infections? Have you ever wondered what really causes urinary tract infections? One of the main culprits is a type of bacteria called Uropathogenic Escherichia coli, often shortened to UPEC. This bacteria is responsible for a significant number of bladder infections, accounting for about 75 to 90% of community-acquired urinary tract infections. UPEC has some unique abilities that allow it to thrive in the urinary system. These bacteria have special features known as virulence factors. These include adhesins, which help them stick to the lining of the bladder, and toxins that can damage cells. UPEC also has flagella that help them move and surface polysaccharides that protect them. They even have systems to acquire iron, which is essential for their survival in the urinary environment. The infection process usually starts when UPEC colonizes areas around the urethra and vagina. From there, it can travel up the urethra and into the bladder. Once inside the bladder, UPEC can multiply in urine and attach to the bladder's epithelial cells. They can form biofilms, which are communities of bacteria that are protected by a slimy layer, making them harder to eliminate. UPEC can even invade bladder cells, creating reservoirs that can evade the immune system and resist antibiotics. This ability contributes to recurrent infections, which can be frustrating for many people. While UPEC is the leading cause of bladder infections, other bacteria can also be responsible, though they are less common. These include Klebsiella pneumoniae, Proteus mirabilis, Pseudomonas aeruginosa, and Enterococcus faecalis, as well as fungi like Candida albicans. When UPEC causes an infection, it can lead to symptoms such as a strong urge to urinate, a burning sensation during urination, and discomfort in the pelvic area. If left untreated, these infections can lead to more serious complications, like damage to the bladder tissue or even kidney infections. Maintaining good bladder health is essential. This can involve practicing good hygiene, staying well hydrated, and seeking appropriate medical treatment when necessary. It is crucial to consult healthcare professionals for proper diagnosis and treatment options. Interestingly, chronic or recurrent urinary tract infections caused by UPEC may lead to bladder inflammation. This inflammation is recognized as a risk factor for certain bladder conditions, including bladder cancer. However, the direct link between UPEC-induced urinary tract infections and the development of bladder cancer is still being studied and is not yet clearly established. In summary, Uropathogenic Escherichia coli is a major player in bladder infections, with a complex mechanism that makes treatment challenging. Understanding how UPEC works can help in preventing and managing urinary tract infections effectively. Always remember to consult with healthcare professionals for personalized advice and treatment options.